Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for today, Monday, June 22nd for British Columbia. Just note that tomorrow at 3 o'clock there will be another briefing involving Dr. Henry and myself. There will be a technical briefing for members of the media, which I believe starts at 1:45, and you'll receive notices about that because we're discussing the modeling at that time as well. The information, the daily information, will be provided as well. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nation, and I'm honored to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today on Monday for our update, our COVID-19 update, we have 3 reporting periods, Friday to Saturday, Saturday to Sunday, and then Sunday to today. So between Friday and Saturday, we had 10 new test positive cases. Between Saturday and Sunday, an additional 6 people tested positive. And between Sunday and today, we had an additional 16 people test positive for a total of 32 new cases in British Columbia, bringing our total to 2,822 people in BC with COVID-19. That includes 954 people in the Vancouver Coastal Health Region, 1,474 in the Fraser Health Region, 131 people on Vancouver Island Health Region, 198 people in the Interior Health Region, and 65 people in Northern Health. We have no new healthcare associated outbreaks, but we have 7 that are continuing to be active, including 6 in long-term care and 1 in acute care. And we're now up to 369 residents who have been affected and 226 staff. We continue to monitor and support at the other active community outbreaks as well, although there are no new community outbreaks to report today. We have 182 active cases in the province, of whom 14 are in hospital and 6 people are in critical care or ICU. Over the past 3 days, we've had 1 additional death from COVID-19 in British Columbia. And we send our condolences to the family, the caregivers, and the community that mourn their loss. There are now 2,471 people who have fully recovered from COVID-19. As I don't need to say, everybody in BC has put an immense effort into staying safe as we gradually restarted over the last few weeks here in British Columbia. As we look ahead, our objective is to keep doing that, to keep our COVID-19 rates low and slow. We know that when the virus is anywhere, the risk is everywhere. And we've seen, again, record numbers of cases being reported around the world, including in our neighboring countries. We anticipate that the phase 3 of our restart plan will begin soon, and the Premier will be sharing more information about this week. We must continue, however, to minimize our cases, to manage them quickly and effectively with public health action and with everybody doing their part, and then modify our approach as needed. The gradual easing of restrictions means more activities can get underway, but it does not mean the change to our basic principles, the foundations of what is keeping us safe here in British Columbia. And that is our safe physical distancing, making sure that we keep our groups small so that we're not exposing large numbers of people, and we know who we can contact if we need to. As well, my order for no more than 50 people at gatherings and events will be in place until we have effective means to stop COVID-19 in our province. The order applies to everyone. The order for restaurants and pubs was amended last week, basically to give more greater clarity on things like the size of barriers. In our attempt to make things more clear for people, we actually created some more confusion. So in consultation, we've revised that again to make it easier for people to understand. Proceeding with caution is very important for all of us now. And particularly if you're considering traveling in another part of the province in the next few weeks and over the summer. We need to be respectful of the communities that we plan to visit and take the same precautions that we are taking now at home. Some towns and regions who rely on tourism are really eager to welcome people, BC visitors especially, and they have safety measures in place, while other communities are still doing their own assessment to determine what's safe and what will be open and available in those communities. And they may not all be ready to welcome people this summer. Respectful travel means maintaining our safe social interactions, planning ahead and being prepared. And if you or anybody in your family or travel group is sick, don't go. If you get sick while you're away, you need to self-isolate immediately and contact your local public health teams to get tested and get direction on how to manage you. It may be best in some cases to go home right away. In other cases, it may be best to stay where you are. And that is where public health will work to support you through this. We also need to plan before we go. Find out what services are available and be as self-sufficient as possible with your own groceries and essential supplies in some of the smaller communities. This avoids putting additional burden on smaller communities if we're traveling this summer. Once away, the same 3 C's that apply, that we've been using, that we've been working on, continue to apply. So that means the high riskier environments are closed spaces, particularly indoor spaces with poor ventilation. Close contact, being within the 2-meter radius of somebody and having those conversations over time. And crowds. The larger number of people that you're around, particularly if it's indoors, particularly if you have close contact, the greater the chances are that somebody may have this virus and it may spread. Anything that involves these things needs to be done with caution. And we need to take precautions to protect ourselves and those around us by maintaining our safe physical distances. And for those short periods of time where it's not always possible to do that, then use of a non-medical mask is what we need to do. I also want to mention that even though our focus is on COVID-19, I want to remind everyone that we always have a high forest fire risk in the summer months. Quebec, unfortunately, is fighting a fire right now as a result of somebody who didn't completely put out their campfire. The burden of COVID, this pandemic, is enough for all of us. So be extra vigilant when you're enjoying the outdoors, whether it's camping in our parks or in some of the federal parks, which will be open soon. And remember to check if fire bans are in place. On this weekend, though, we've seen many examples of ingenuity and creativity in helping people celebrate important milestones and important days. Yesterday, National Indigenous Peoples Day and Father's Day. I watched some of the really impressive Indigenous Peoples Day celebrations that were online. And right across the province and across the country, we saw virtual events that were celebratory and were safe, including many graduation events that I was really impressed to see across this province. I've heard from many people that have seen that there is so much we can do by staying safe, staying apart, but connecting with each other socially. So no matter what your summer plans may entail and where you may be respectful and be understanding of the communities that you're going to. The foundations that we have set for our safe social interactions will remain regardless of what phase we are in. And it's not like we're changing dramatically. What we're doing is we're increasing the dimmer switch, we're moving, expanding to more areas, but the foundations are the same. Let's continue to take care of each other and do our part to protect our families, our communities, and our province. And let's also continue to be kind with each other, to be calm and understanding, and to be safe.
Thank you very much, Dr. Henry, and I wanted to, on behalf of myself, of the Premier, and the government, pass on our condolences to the one person who's died in the last 3 days from COVID-19 in British Columbia. That makes 169 in our province since the beginning of the pandemic. We know, and I know we've talked about many times, we know what a difficult time this is for people to get together and the need to support one another, especially in our grief and our sorrow. So we want to especially pass on our condolences to those families today, and they are in our thoughts. I wanted to note there are now 14 people in acute care with COVID-19 in BC. This is slightly up over the numbers from Friday, 8 in the Fraser Health Authority, 6 in the Vancouver Coastal Health Authority. We continue to see the very similar rate of visits to our emergency room, yesterday about 5,359, which is, well, it's somewhat below the pre-COVID-19 average. It still represents people coming back and using our emergency rooms. As you know, that yesterday the World Health Organization reported the largest single-day increase in COVID-19 cases in the world. That's 180,020 cases on June 21st, long after the beginning of the pandemic. In the United States, Oregon, California, and Arizona broke records for the largest single-day increases in COVID cases in the last week. British Columbians, of course, have profound connections to the United States, and what those circumstances tell us is the need to be vigilant here. Our closest neighbors to the south in Washington State have seen in the last week, not counting today, 2,846 new cases in a period where we've had 83 in British Columbia, 56 new deaths in a period where we had ourselves, sadly, 1 new death in our province. People have made tremendous sacrifices to get where we are, but this is a worldwide pandemic and requires as well a worldwide response, and we are in it together. I think what it tells us is, as we open up our society as well, the need to maintain physical distancing is increased, not decreased. That physical distancing saves lives, especially now, especially as we are all doing more things together. I wanted to give you an update on PPE, as I do every week, just to review the results in previous weeks from the end of March to last week's report on Tuesday, June the 16th. The following PPE has arrived in BC: 5,795 N95 or equivalent respirators, over 10,500,000 surgical or procedure masks, just over 2,250,000 pieces of eye protection, including goggles and face shields, over 41 million pairs of gloves, almost 2,500,000 gowns. Many of the items I've listed are in our testing process to make sure products meet or exceed safety requirements before they're used in our healthcare system. Today, I can tell you that over the last week, since my last update, which was Tuesday, June the 16th, we've received the following: 19,595 or equivalent respirators, 9,477,700 surgical or procedure masks, 66,888 pieces of eye protection, 5,880,150 pairs of gloves, and 260,691 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective products for our healthcare system. In closing, I'd say the last 3 months have offered us all some powerful examples of what we can do, of what we must do in a global pandemic. Early on, a BC CDC scientist realized we could use swabs from one type of test kit, of which we had thousands, to bolster the supply of swabs in the COVID-19 test kits we all rely on. A young person used a 3D printer to make ear gears for masks so the elastic straps were less irritating to the user. In mere weeks, we switched really from a single site to a single site staffing in long-term care homes, and we went from postponed surgeries to a renewal commitment that has seen us return to the number of surgeries we performed pre-COVID-19. From the simple to the complex, from products to systems, from people working on their own to those part of large and even global teams, we invented, we improved, we redesigned, we repurposed, we renewed, we did better. COVID-19 showed us how we could find the strength within us, the drive to do what's needed, what's required, because that's what's necessary, not just for us, but for all of us. COVID-19 has taught us many things. Some lessons are positive, and some lessons are painful. But COVID-19 has taught us how we can do things better, and has also shown us where we must accelerate change in health, in business, in our communities, our society, and in ourselves. COVID-19 has taught us many things. Most of all, it's taught us that each one of us has the duty to be the change, so every one of us has the chance to share the change. Thank you very much. Merci beaucoup. Je vais dire quelques mots en français et puis on va prendre vos questions. Excusez-moi. Voilà. On a une autre page. Juste pour dire que nous avons eu des derniers jours un nouveau décès de COVID-19 en Colombie-Britannique. Ça veut dire 169 décès depuis le commencement et on continue à offrir nos condoléances à tous ceux et toutes celles qui ont perdu leurs proches. Nous avons maintenant, il y a quelques mois, 32 nouveaux cas de COVID-19 en Colombie-Britannique depuis 3 jours. Ça fait 10 de vendredi à samedi, 6 de samedi à dimanche et 16 de dimanche à aujourd'hui. C'est 32 nouveaux cas. Il y a bien sûr il y a 6 personnes qui sont des cas intensifs dans nos hôpitaux et 14 qui sont en total hospitalisés. Merci beaucoup. Thank you very much. We're happy to take your question.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. Today, moving forward, we will allow 1 question and 1 follow-up, please. And also, unmute your phones, please. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Question for Minister Dix. On Friday, the Métis Nation released a report on anti-Indigenous racism within the healthcare system in BC. Report is dated March 2019. Were you aware of that report before they released it? And if so, what did you do about it?
So, Vaughn, there are 2 reports in question. I just want to, I'll just spend a little moment because we received, I think, a number of questions. So, from members of the media, and I'll maybe take this opportunity to sort of give some background. The SANIUS Indigenous Cultural Safety Training Program was created some years ago, 14 years ago, with a requirement to increase cultural competency within health authorities. It's an education tool to understand the realities of what individuals accessing the healthcare system experience in real life. There have been in the tens of thousands of people who've gone through this program from the beginning. The 2 reports that were referred to, I'll just say this, one was prepared for a conference, so it was an analysis of data collected through the SANIUS training program. It was developed to support the conversation at a think tank that took place, as you note, on March the 12th, 2019. And that report has been used by Indigenous health teams to assist in their day-to-day work. But that's not a report that was brought to my attention. It was prepared for a meeting by the SANIUS health team. The second report is not, in fact, completed. It's still in draft form. It's titled Dismantling Anti-Indigenous Racism Within the Healthcare System. And it was intended to use the think tank and the initial report to guide discussions. It was commissioned at that time. It's not yet been finalized or finished. The editing and review took place up to January 2020. The intention in February and March of this year was for the report to have engagements to review the report with elders and with think tank participants, and that process was deferred due to COVID-19. So that report that was shared is in draft form. It hasn't been shared with me. It hasn't been shared with leadership teams at the Provincial Health Services Authority. The idea before finalizing it was to share that report with participants, including the BC Association of Aboriginal Friendship Centres, the Métis Nation, and so on. The details of that report was shared as part of a meeting on Wednesday, June the 17th. So that report was shared in its draft form, and then it has subsequently been released. So in both cases, I haven't seen those reports, but the second report, the substantial one that includes recommendations, is a draft report. It hasn't been finalized and hasn't been provided yet. I think there's a follow-up, right?
Vaughn, do you have a follow-up?
Yes. The Métis Nation is also saying that they hope that they and other Indigenous groups will have some input into the terms of reference for the inquiry that Mary Ellen Turpel-Lafond will be conducting, and in particular, they want to be sure there's whistleblower protection for healthcare workers to come forward and tell the kind of stories that are in these this dismantling of anti-Indigenous racism report. As you know, there's a bunch of stories in there. So they're wondering when we'll see those terms of reference, whether they'll have some input, and will there be protection for whistleblowers, please?
I think on the latter, certainly yes. On the former, the terms of reference are being developed with Mary Ellen Turpel-Lafond. She's looking at what she needs to do, what is required to address these issues. I expect that she will reach out to a number of groups. Over the weekend, for example, I had meetings with a number of groups, including the First Nations Health Council and others, and a wide variety of our partners, both at the First Nation Health Authority, the First Nations Health Council, the Métis Nation, and others. So we've had some of those discussions, because I think there's two things that obviously need to help to happen here. We need to take actions, and we need to respond to concerns in the immediate. We need to continue to build on all of the work that's been done since the SANIUS program began near the turn of this century, and then the work that's been done since 2015, the work we're doing together with the First Nations Health Authority, the First Nations Health Council every day. And there's been a lot of progress made, and there are massive challenges still to come. And so with respect to the terms of reference of the report, Mary Ellen Turpel-Lafond will be developing them and working then with me on them, presenting what she needs. I understand that she'll be reaching out to Indigenous groups as part of these discussions over the next few days, and then as soon as the terms of reference are finalized and we work together to ensure that they meet the tests, they'll be made public.
Next question is from Ethan Sawyer, CBC.
Hi there. This question is for Dr. Henry. What concerns do you have given the rush to book holidays now, especially on Vancouver Island? I believe they've had 14 days, or sorry, with no 14-day quarantines, BC could be injected with fresh COVID cases coming from other parts of Canada. And can U.S. travelers now fly to BC and stay?
So addressing the international travels, anybody coming from outside of Canada, including the United States, whether they fly or drive, is subject to a federal quarantine order and a provincial order, and they must quarantine, and there are restrictions on who can come in. And currently that means you have to be on essential business or an essential worker or family reunification with some qualifications. You have to be staying more than 15 days. So that is one of the ways that we are protecting our communities. We also have never had travel restrictions on people coming from other parts of Canada, and we know there's been a lot of work done across the country, and that we are managing this pandemic in Canada fairly well. So I'm not particularly worried. I think we all need to do our part, continue to do the foundational things that have got us here, but really we want to focus on BC for BC and how important it is for us to be able to enjoy our own province and our own natural environment here. And so that's the focus for this summer. I will say though that, you know, we will welcome our family and friends from across the country, and we know that this is a pandemic that is around the world, and there's going to be very limited travel internationally, and just because of demand and because of concerns that we continue to see this virus affecting communities around the world. So we will take the measures that we need to take, and importantly, it's about staying away if you're sick, knowing what to do if you develop symptoms, and staying away from others, calling 811, making sure you can get tested, and as we talked about, having respectful travel. If you're going to a smaller community, make sure you check ahead what's available, what is open. And as we know, some communities are not prepared for visitors this year because of the nature of their communities, and we need to be respectful of that as well.
Ethan, do you have a follow-up?
No, I'm good. Thank you.
Thank you. Next question is from Les Lane, Times columnist.
Doctor, I was looking at the global numbers that you were referring to, and it looks like it's basically rampant in many parts of the world, and the growth rate's holding very steady closer to home in the U.S. The quarantine, I guess, captures or protects BC a lot from that, but are you optimistic that BC can maintain its extraordinary numbers given the higher rates in Ontario and Quebec?
Well, I can say I'm really heartened to see that things are going in the right direction in Ontario and Quebec. And we know there's been some challenges with large outbreaks in Alberta, but those are also coming under control. And if we look across the country, I think we have a coordinated response here in Canada that is helping us all get through this. But of course, we are at that point where this virus, as I've said, when it's anywhere, we're all at risk. The risk really is everywhere. And as we increase our travel, even within the province, chances are we are going to have more cases. We know that. We know that even as we went into phase 2, as we're transitioning and more things are opening up, it is likely and absolutely we're going to have more cases. So that's why it's so fundamental that we continue to do the things that we've been doing that have worked. And that means maintaining our physical distances, maintaining those distances in retail stores in the places that we're going, keeping our bubbles small. And there's 2 reasons for that. One is we're reducing our risk of being in contact with somebody who has this. But the other one is it's so that we in public health can manage this and keep it under control. So if we can catch outbreaks early, we can catch people early, we can prevent others from, we can break those chains of transmission. Very similar to where we were when we were having introductions in January. And that's what we're working hard on in public health, making sure we can do that. And I'll talk a bit more about that with some of the models tomorrow. I think it's really important for us to recognize that we're in a balancing act here. We are going to see more cases, but we all need to do our bit to keep them as low as possible so that we can make sure that we're addressing the unintended negative consequences that many people are feeling from the restrictions that we had in place. Whether it's economic, whether it's social, whether it's the ability to be with family and friends when you need them. The types of connections we've had have got us through this period, but we need to take measures now to make sure, as we did, that people are getting the surgeries that they need, people are getting the health care that they need, people are getting back to work and getting those important things back to school. And this will be our last week of our spring school session, and we've learned a lot from that. So these are the things that are really important. We need to start addressing some of the other things that this pandemic has really pushed to the side and making sure that we can support people around other measures that are happening. So it is all of us, it's incumbent on all of us to continue to do those fundamental basic things that will get us through the next few months.
Les, do you have a follow-up?
Just a quick one. You go to phase 3 in the next few days, I guess, or a week, and you get an expected uptick. Is there a threshold or a trigger where you would tighten the screws again and go back to phase 2, or is it just a judgment call?
Yeah, so no, there's not one specific thing. There's a number of different indicators that we'll be looking at. Really importantly, our cases just popping up with no connections. Those are things that we'll be looking at, and we have some tools that help us investigate that. So we have tools like whole genome sequencing that can help us link where cases may have come from. We have a lot of work that we're doing in public health to make sure we can find people quickly and we can find your close contacts quickly. So again, it goes back to the importance of having small numbers, few faces, big spaces, so that we're not trying to catch 1,000 people. We're trying to manageable numbers of people. And we've seen this happen. We've seen small numbers in a workplace. And if we can catch it early, we can make sure that those transmission links are broken. So that's what we'll be focusing on. Our whole plan from the very beginning was to move thoughtfully and carefully and slowly through this in ways so that we all learn the things that we need to do. and we don't want to go backwards. We won't be going back in terms of the phases, but we may need to, in certain areas, restrict some types of activities or look at certain situations that are more risky. And what I'm thinking about are things like certain workplaces or places where people are in common accommodations. Long-term care is an area that we'll be looking at and making sure that if we start to see more introductions into long-term care, then we can step back on the restrictions in those areas.
Next question is from Sky Ryan, CHEK News.
Thank you. My question is for Dr. Henry. When will antibody testing be available in BC to give us a better idea of just how many COVID-19 affected people are out there? I interviewed a woman today who believes she had a severe case of COVID. Her physician also says she displayed all the symptoms and that she's still suffering from loss of breath. She's very exhausted. But her COVID test was done 3 weeks after she first displayed symptoms, and it came back negative. She's being considered a presumptive case, and I'm wondering when we'll get a better idea of how many cases like hers are out there, and if that is going to happen, what benefit that would be.
Yeah, so we've already started, as I mentioned, in terms of determining how good the tests are, how valid they are, and what we need to do. So those processes are ongoing. We've started 2 of the studies that we've to look at population level infections, and I'll have some of those numbers in the hopefully tomorrow, if not later in the week. They're still processing some of the data. So there is a much broader initiative that's happening both at the provincial level and the federal level. So we are going to be targeting people who believe that, and we believe, had COVID-19 over the past couple of months to determine if they have antibodies. We've started with some of the known outbreak areas, like in the Lynn Valley Care Home, for example. There's also a national initiative that's going to be doing a blood spot test, which is we're now understanding the parameters a little better, and this comes out of our immunity task force at the national level, and we'll be participating in that, and we'll be looking at testing 140,000 people across the country. So that should be rolling out in the next few weeks as well. So a number of these initiatives, really important ones that help us understand, not so much on an individual basis, but particularly on a population basis. I will say as well that we're around the world, scientists are still looking at what it means to have antibodies and how long do they last. So those will be important questions that we still don't have definitive answers to. There's been a couple of reports that have come out in the last week, one from China in particular that showed that people with mild symptoms or who were asymptomatic didn't have antibodies that lasted for a long time. So we don't know if that means they just weren't the antibodies to what we were measuring with our test, and we don't know if that means they're protected from reinfection. So those are all still important questions that all the immunologists around the world are trying to work out. We didn't see that in some tests recently from the UK, which showed that there was actually antibodies for a longer period of time. So all still questions that we need to answer, and that I'm hopeful we'll have at least way more answers before we head into the fall and the influenza season.
Sky, do you have a follow-up?
Well, as for that second wave or that fall outbreak that could be happening, I spoke to many people who have loved ones in care homes, and they have reached out to me saying, will we be able to visit our loved ones in any capacity, PPE supplied or outdoor visits in advance of that possible second wave? They're being told that they're getting appointments for window visits into August at this point, and they're fearing that their whole summer may have no visits. And I'm just wondering if you can speak to that, Dr. Henry.
No, that's a really important question, and something that's been something near to my heart, and we've been working on for a number of weeks. And yeah, it's such a challenging question, and it's more complicated, and we all want to be with our loved one, and we know how important it is for them to have family with them, but we need to do it safely. So it's the combination of staff availability, making sure that staff are safe, making sure we have the PPE, and you heard the report today that we are finally in a relatively good place for that, which we have not been for some time. So the short answer is absolutely yes. I do believe we will be having visits in a controlled way in care homes in the coming weeks.
Next question is from David Wiley, Daily Courier.
Yeah, hi there. This is a question for Dr. Henry. By now, we'd think that everyone in BC would be aware about keeping gatherings small, but we saw in Kelowna a crowd of a few hundred people from Mount Boucherie Secondary School, graduates and their parents gather at Waterfront Park here in Kelowna. So I'm just wondering, what is your reaction when you see people still gathering in such large numbers?
You know, it's our approach to this has always been helping explain what we need people to do and why, and relying on people to do the right thing. So I would continue to encourage people to have these celebrations, and we've seen many really great ways that are innovative ways that we can celebrate our young people when they're going through these transitions. And that's what we need to focus on, how to do it in a way that celebrates these important milestones, but does it safely so that we're not putting people at risk. So being outdoors rather than indoors, but even outdoors, making sure we're keeping our physical space. The 50 is there for a reason. We've talked about it a number of times. It's a manageable number. So have several different smaller groups rather than one large group. And I continue to ask people to be, to realize that this is not trying to be punitive. This is because we know that these are the things that will protect us from getting this virus and passing it on to those we are closest to, because that's how this virus spreads. It spreads when we are in close contact, particularly indoors, with the people that we are closest to. So it's about protecting our communities, our families, our loved ones.
David, do you have a follow-up?
Yeah, just quickly. I mean, a crowd like this is pretty hard not to notice. So I wonder if there's any way that it would be possible to move a group like this along, or have some sort of enforcement for them to abide by the guidelines.
So it is a rule, and bylaw officers, our CMP, have been involved in some parts around the province of reminding people of these rules and encouraging them to move along or to split up into smaller groups in different areas. And we know there's been a couple of examples of that over the weekend where that has been effective. But our approach has always been one of education and working with people to make sure that they understand. It's not an enforcement approach, because we know that people are trying to do the right thing. And so it is the approach of taking it in a measured way, as we have all along.
And I know we've reminded people this many times before, but I think it's important to remember that those you're most likely to transmit COVID-19 to, if you are stricken with the virus, if the people you're most likely to transmit it to are the people you love, the people you know. And so that obligation is important. Overwhelmingly, I think the provincial health orders, which are not many but are clear, are being followed everywhere in the province. And I'm very proud of British Columbians for doing it, such that when there are cases where people sometimes don't follow them, they really stand out. And we really, really, really need to dig in now, because we need to, of course, open things up and open up opportunities in the province. It brings us all closer together. Physical distancing saves lives. You don't have to look any farther than Washington State or anywhere else to see the impact of that. And the people you're most likely to hurt are the people you love, which is a good reason, amongst the many others, to follow the orders that the provincial health officer, Dr. Henry, and medical officers of health in the regions have put forward for people.
Next question is from Keith Baldry, Global News.
Thanks, Dr. Henry, for taking my question. A bit of a lighthearted one. A colleague from Global tonight is doing a story on a new cottage industry that's taking hold in BC, and that is a rising number of merchandise, baseball hats, T-shirts, plaques, even tea towels with your likeness or your picture, your name on it, and the money's being going to charity, and proprietors tell us it's flying off the shelves. It's their #1 seller. Just What's your take on something like that? And did you ever see anything like this coming?
No, absolutely did not see it coming, and it's kind of a little disconcerting. I am pleased that the money is going to something that is important, and I know many people are supporting a number of initiatives like the food bank. I know we're supporting the WISH initiative in the Downtown East Side and a number of others, and for that I'm grateful. And if using my likeness can help with that, then that's a good thing. I will also say that, you know, people have sent me some really interesting and amazing things as well, including some beautiful art, a hummingbird that's very precious. But I've also got a number of masks that I really like, and so thank you for those.
Anything else, Keith?
No, I'm good.
Okay, thank you. Marcella Bernardo, News 1130.
Dr. Henry and Minister Dix, thank you for taking my question. You touched on this a bit regarding the 50-person rule, and considering how many people were spotted ignoring social distancing orders, not just in Kelowna, but Vancouver's entertainment district over the weekend, how concerned are you about what I've heard referred to as pandemic fatigue, in which people are just in denial now and no longer bothering to follow the rules? And are you concerned about the number spiking that may further delay the start of phase 3?
Yeah, you know, this is something, complacency, concern, people being tired of this. I think we all want this to go away, and I certainly do. But I think the thing that stands out, as Minister Dix mentioned, is we recognize these things because they are not the norm. We are seeing more people out and about. We are seeing more people going into work, but we're learning as we go the processes that keep us safe in doing that. It is concerning to me when I see, you know, things that I heard about on the weekend in the entertainment district, where fights broke out, where things like that happen. And, you know, some of it is pent up concern, I think, and anxiety. And it's also one of the reasons why we need to continue to move forward and to open things up and give people avenues to congregate. We're social beings, so we need to do that, but we need to do it in a way that best protects us. And we need to recognize that is possibility of leading to more cases. And how can we best protect those who are most vulnerable to the severe effects of those new cases? So why it's so important for us to keep it out of our long-term care homes, to make sure that businesses where particularly elderly people are protected. So we need to find that balance, and I think for the most part here in BC, people are doing the right thing. We are finding that balance. And if you are somebody who's going out and taking these risky behaviors, you need to know for yourself what the risks are, and stay away from people, from your grandparents, from others in your life who may be going through medical treatments, for example. So you need to take that responsibility to monitor yourself and get tested if you get any signs of illness.
Follow up, Marcella?
Yes, please. Just regarding the new case on Vancouver Island, how much concern should there be about that? Because for a number of weeks, they only had 130 case count on the island total. And is that something that we should be worried about, considering that it's no longer an island?
Yeah, I think I've said all along, when people have said, oh, you know, we're on an island, we can be complacent, that people travel, and this virus is spread between people, and we know that we cannot survive on this island without having people coming back and forth with our groceries, with all kinds of things, even if it was only essential travel. We know that there's people who need to come to look after family members and other things like that. So it is not a surprise to me that we've seen a case here. We've had a case in the interior as well this week, or this weekend, where we haven't seen a lot of activity for a while. It reminds us this virus is still circulating in our community. Thankfully, here in BC at a low level because of the things that we've done together. But we all have to continue to take those measures that protect ourselves and protect our families. And this is just another indication of that.
We have time for one more question. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Shannon Waters, BC Today.
Hi. The Canadian Federation of Nurses Union says it is going to start an independent investigation into whether healthcare workers across Canada have been adequately protected during the COVID-19 pandemic. They're saying that the infection rate for healthcare workers here in Canada is triple what many comparable jurisdictions are seeing around the world at 19%. And I note that here in BC, that infection rate is actually higher. As of April 28th, I believe it was reported at 21%. So I'm looking for your reaction to what you think this investigation might find and whether you think the province has taken adequate action to protect frontline healthcare workers to date.
Yeah, I think we need to be cautious when we look at the healthcare worker data, because we include healthcare workers no matter where they were exposed. So many people who are healthcare workers were exposed at things like a conference that we know a lot of people attended. There was personal travel. There was also transmission between healthcare workers in settings where they may not have realized was a risk. So in lunchrooms and break rooms and things like that. So there are many different places where we as healthcare workers can be exposed to this virus, including in our communities. So I believe here in BC in particular, because we have taken the measured approach that we did and the way that we distributed things like personal protective equipment, that people were well protected here. And we should see that in a number of things, including the survival rate of people who were in hospital and in ICU. That to me tells me that we had the time and the resources to make sure everybody was protected in those environments. It's a very challenging problem, but I think the other thing that's really important, I was just trying to catch my thoughts there, is that we cannot rely on a mask, because the mask is not what keeps us safe. It is an added layer, but it's at the bottom of our pyramid, what we call the hierarchy of controls, the things that keep us safe. And in healthcare, the most important ones are the things that are administrative controls, things like keeping all the COVID patients in one area, putting up, making sure that we reduce the number of people in the room when we're doing certain procedures. Those are important. Those are the things that keep people safe. Putting up barriers, the engineering controls, so that we don't have to come face to face with somebody who might be sick with this virus. The same things that we're doing in grocery stores, where we're protecting people by putting up plexiglass barriers. Those are the types of things that we have in our healthcare system as well to protect us so that we're not being exposed to the virus. So we need to have all of those things in place to protect people adequately, and that's a very important last resort piece of it is, of course, making sure that we have masks and eye protection and gloves and hand hygiene available all the time for all healthcare workers who need it. So it is a complex problem, and not simply by looking at the percentages of healthcare workers who are infected can you get to all of the different aspects of the problem.
Do you have a follow-up, Shannon?
Yeah, just a quick one. Has BC been tracking the number of healthcare workers who have been infected on the job, and possibly the information around, what led to them becoming infected at work? And also, will an update on the number of healthcare workers infected be part of tomorrow's modeling update?
I hadn't put it in there. We do track if somebody is a healthcare worker, but I can provide you with that percentage. We don't every single one have where they were infected, though we generally have an idea. The number who have been infected at work, again, is smaller than the overall number, that percent, but I don't have the numbers off the top of my head. In some investigations, this is one of the things that we will be sharing as the information gets pulled together. Now that we've had a bit of time. As you can imagine, we've been incredibly busy with managing of outbreaks, but we're now starting to look at the data to see what we can learn from it. And we're looking at the data around the outbreaks in long-term care, for example, and where people became infected. And we have a couple of, as you're aware, acute care facility unit outbreaks. And so we're looking at those in some more detail as well. So we will have some more information about that.
That's all the time we have for today. Thank you.